Aloha. Welcome to Pearl Harbor National Memorial's YouTube series, For Whom the Bell Tolls. I am Ranger Holly, and I am here today where the Hickam Field Station Hospital was located, December 7, 1941. It was just 3 blocks away from the barracks along the runway, where the bombs hit first that morning. One such bomb left a 30-foot crater 20 feet from the hospital wing, and another fell across the street. On December 7th, the Army Nurse Corps had fewer than 1,000 nurses altogether. By the fall of 1941, only 82 Army nurses were stationed in Hawaii, serving at 3 Army medical facilities: the Station Hospital at Hickam Airfield, the Station Hospital at Schofield Barracks, and at Tripler Army Medical Center. Hickam Station staff consisted of 7 medical officers, 5 dentists, 7 nurses, and 40 enlisted men. One of those nurses was Major Annie G. Fox, the first woman to receive the Purple Heart for combat. Joining the Army Nurse Corps in 1918, she served in New York, at Fort Sam Houston in Texas, Fort Mason in California, and Manila in the Philippines. She was assigned to Honolulu in May of 1940. She was granted an exam for promotion to Chief Nurse August 1st, 1941, and was promoted to First Lieutenant and transferred to Hickam Airfield November 1941. Lieutenant Fox was Station Hospital's head nurse at Hickam Field that fateful day. Although long serving in the military, the surprise attack December 7th was the first combat experience for her. Within minutes of the first bombing run, casualties began pouring into the hospital and continued to multiply while the bombs fell around the hospital itself. They were being strafed by Japanese dive bombers and Zero fighters, overwhelming the hospital with burn victims. Amid the noise and confusion and working around supply and bed shortages, Lieutenant Fox organized the other nurses and wives of military personnel in order to provide the best care under the circumstances. Instead of idyllic sounds, sights, and scents, the staff heard screams, saw billowing black smoke, and smelled burning petroleum. With no electricity and water not always available, these nurses and volunteers wore gas masks and helmets as they tended the wounded. For her efforts during the Oahu attack, Fox was presented the Purple Heart, October 26, 1942, at Hickam Field. Colonel William Boyd, post commander, read the citation, commanded by Brigadier General W.E. Farthing and signed by Colonel L.P. Turner, Air Corps Executive Officer. Her citation read in part, "For outstanding performance of duty and meritorious acts of extraordinary fidelity. During the attack, Lieutenant Fox, in an exemplary manner, performed her duties as head nurse of the Station Hospital. In addition, she administered anesthesia to patients during the heaviest part of the bombardment, assisted in dressing the wounded, taught civilian volunteer nurses to make dressings, and worked ceaselessly with coolness and efficiency, and her fine example of calmness, courage, and leadership was a great benefit to the morale of all with whom she came in contact." In 1942, the Purple Heart criteria changed to those wounded or killed in action. October 6, 1944, Fox's award was changed to a Bronze Star because she was not wounded in the Oahu attack. The Bronze Star is the 4th highest combat award of the United States Armed Forces. Before she retired from active duty in December 1945, Lieutenant Fox was promoted to captain and then major. It is important that we continue to tell the stories of those participants in our armed conflicts for a number of reasons. Memorializing their stories provides us with hope, the belief that an individual can make things better. We also have the opportunity to tell the undertold stories of minorities of all backgrounds. These stories remind us that we need to work together for the common good of survival, and that we can't do so if our energies are directed toward fighting each other. Please join me in saluting Major Annie Fox for her efforts in preserving humanity under great devastation.